Okay, this is a good teaching point about a Baker cyst. I'm going to flip this camera around and show you what we're dealing with here. Looking at here is the back part of the patient's leg, the back part of the knee, and many of you have heard of a Baker cyst, which is really just overflow of an inflamed joint fluid that kind of pushes out the back through this little valve. And usually it manifests right here, it collects right here, that fluid does, and it forms a little bit of a bubble. Sometimes you can actually feel it, it feels taut. But a lot of times the cyst will actually extend, it will kind of expand, go up underneath the hamstring, maybe down underneath the calf muscle, and that can cause a lot of pain and dysfunction. So you'll see in this patient, it's not a simple cyst that just sits as a bubble or a little water balloon right here. Let's look at the ultrasound. This is classically a Baker cyst sits between the medial head of the gastrocnemius muscle, the calf muscle, which is here, and the tendon of the semimembranosus muscle, which is one of the hamstring muscles and tendons. So this is the Baker cyst, and usually that's all it is. It's kind of a bubble, water balloon right here. But if I play this, what I start to do is scan it. So you see the bubble there, and I follow it, and you can see it dive down, and it's still there. It's sitting underneath this big hamstring muscle, even several inches up into the back part of his thigh. So again, it's usually just right there, but this one extends all the way up under all this muscle, and it goes quite far up his leg. So you can imagine how much dysfunction this would cause with his hamstrings when he's doing any sort of functional thing activating this muscle. So he's going to get a lot of pain relief when we get rid of some of this fluid, and it's another reason to use ultrasound. If you didn't use ultrasound, you would not be able to appreciate the fact that this fluid is much more extensive than sometimes you'll see in patients. So the other reason to use ultrasound is you can avoid these areas, which are vessels. You don't want to hit those. So anyway, Baker cyst aspiration is what we're about to do.